Hi everyone, it's Dr. Jen from Jen Med. Today I'm doing a short video. I'm on the road, but we're going to do a short video on how to check your blood pressure. Now I encourage all patients with high blood pressure, even if you don't have it maybe when you reach a certain age, to invest in a blood pressure machine. Nowadays you have the automated ones like this one here. They have the ones that you put on the wrist, kind of like this bracelet. You just clip it on your wrist. I tend to prefer the one that goes on your arm. All right. So this is the machine. There's a connection to the cuff, right? And there's a correct way to check it, right? So the first thing you want to do, ideally, is that you ought to be sitting in a chair that has support. Your feet are flat on the floor. Your arm, there should be an arm rest or something that you can put your arm on. That's the ideal way. Okay. So with the cuff, see the cuff here, right? You're gonna stick your arm through. Look. But it's very important that the cuff, where it says the artery mark, that little line there, it should line up with the artery, which is basically on the inner part of your arm. Okay, so about right here. So that line should line up with that, okay, on the cuff. And it should be where your elbow bend. The cuff shouldn't be right into the where the elbow bend. It should be about an inch above it, right? And then you pull and secure, so it should feel snug. You should be able to get 2 fingers under it. It shouldn't be tight like that. Okay, good. So it should be snug so that at least 2 fingers can go in. The artery mark should be over where the brachial artery is found, which is, as I said, the inner part of your arm, about here, right? And then you close it. Now the cuff should be wide enough to go around your arm. If you are fatter, you need to get the extra large cuff, because if the cuff is too tight or small for your arm, it's gonna give you wrong reading. It's gonna give you a reading that is usually too high. So that is how you put on the cuff. Line it up, a little space here. You should be sitting down on a chair that has support, as I said, with your legs flat, and the cuff should be almost in line with your heart, and then your hand should be placed on a table, so it's like, or on your lap. Then now with the machine, it's pretty straightforward. You press the on button, and then you just wait for it to pump up. So like now it's pumping up, right? And then when it's done, it will give you a reading. It's that simple. So you want to make sure that you do it the proper way. You don't have to be perfect, but so that you have consistent readings. A lot of patients say, boy, doc, sometimes I check the pressure is this or that. Sometimes how they put on the cuff is wrong. So that is why you're getting inaccurate readings. So the most important thing, and if you're getting inaccurate readings, you may consider rechecking with a different machine and seeing if you're getting the same readings. All right. Hope that helps. Until next time, this has been Dr. Jen. Bye.